This is an informational presentation about testing and treatment for COVID-19. I would like to disclaim that there is ongoing research and new data on COVID-19 every day. This affects the patient and patient care plans. The reason for this presentation is to provide basic information about the trending and anecdotal claims about the COVID-19 and method of testing and treatment. Therefore, the information shared is strictly publicly known. This is not a comprehensive or scientific study or to be used for clinical decision making. As the scientific community continues to study the viral profile and methods for testing and treatment for COVID-19, we will all learn more. To begin, when an individual is exposed to a pathogen, a disease-causing organism, the body builds a defense. This slide illustrates two pathogens, bacterial and viral. There are many more. Nevertheless, as you can see as depicted, the pathogen invades and begins a replication process. Bacteria replicate on its own, whereas virus uses the host genetic material. Viral proteins can cause disease, and we know that the smallest particle, known as a prion, can cause such illness. So in the case of SARS-CoV-2, we look to test for the virus. We use a nasopharyngeal specimen and the reverse transcription polymerase chain reaction to identify active infection. This is the only method to actively diagnose. We'll also discuss antibody testing, but for now, nasopharyngeal testing can identify the pathogen. Again, this is how we determine active illness. In response to this invasion by a pathogen, the body's defense mechanism combats the promulgation and replication of the virus or pathogen. This is mediated by antibodies. We have many different types of antibodies that protects us or provides immunity from pathogens. Antibodies are also called immunoglobulins. IgA, IgM, IgG, and so forth. They trap, tag, or destroy pathogens. They also activate the immune system and white blood cells. This is depicted by the Y-shaped antibody, or A. They tag and trap the red round pathogen B. They also present the pathogen B to the white blood cell, which is C, to be destroyed. White blood cell will signal for more white blood cells to be formed to support the defense. Our defense is mounted, so we develop immunity when we're exposed to a pathogen. Immunizations, active exposures, allow this immune system to form a defense. However, anytime a novel virus, such as SARS-CoV-2, invades our immune system, a ready defense is not available, and there is no protection from the invading pathogen or developing symptoms. Thus, the virus invades the cells and uses the genetic material to build more clones of itself. Our white blood cells are affected. Our defense is subdued or hampered. We begin to show symptoms. We cannot defend against the active invasion. Worst case, our immune system goes into an all-out attack, targeting our own healthy cells and organs. This has been seen in the most moderate and severe cases of COVID-19. Let's review. The host, you, are exposed to a pathogen, SARS-CoV-2. Your immune system responds with the buildup of antibodies, immunoglobulins, such as IgM. The formation of these antibodies, remember, they tag, trap, and destroy pathogens. Then specific immunoglobulins, such as IgG, they're responsible for future immune response. if you have enough levels of IgG detectable in your serum or blood test, it is thought that you have built an immunity, and you probably were exposed. In subsequent event of exposure, your immune system should be able to alleviate the invasion. So antibodies build up after an infection. IgM is the immediate response, and IgG is for a second response and memory for future exposures. Testing is used to determine active illness and post-exposure. Do you remember which test is for active illness? For active virus, we would use the nasopharyngeal swabbing. Do you remember what test was used to determine exposure? We would use the antibody test. So let's discuss testing for active illness. First, we need the validated and vetted method developed by the CDC. State labs and some special private labs were initially allowed to process and test specimens. Later, additional private labs were allowed special authorization to test specimens. Now, the collection of the specimen determines a positive test, and it requires a viral load or a viral count. So the specimen is obtained. The best chances of identifying the SARS-CoV-2 virus is at that time. The longer the specimen sits unrefrigerated or not maintained at a temperature to preserve the sample, the virus deteriorates. In Korea, traffic and roadways were closed down. This may have attributed to lower identified numbers of positive tests. In addition, the tester performing the collection of the specimen swab may not have introduced or placed the applicator in the proper placement or was unable to obtain enough of a specimen. Now let's discuss that individuals need to be symptomatic. That's how we tested. We now know that even symptomatic individuals have false negatives to the nasopharyngeal test. The range of false negatives ranges from day 1 of symptoms to day 11. This is a large percent. Now we are testing to confirm illness and identify populations with active illness. We need to know this number. The number of active illness are the ones that are actively infected. Remember, antibody tests only identifies post-exposure infection. So this helps us to know how many exposed or how many have contracted the illness, no matter the acuity or seriousness of the symptoms. So in some cases, people have not had any symptoms but have done the antibody test, and it means that the antibody test, if it's positive, ramped up enough to create an exposure to the pathogen. If you are not exposed and you do not have active markers or antibodies, you probably did not contract the illness. However, sometimes your immune system does not require antibodies to form. Your immune system is strong enough that it may have curbed the pathogen without symptoms or illness, or the need for the antibody response. The prior is more likely. Vaccine development takes years of safely acquiring data and testing for public safety. This process or stages of pharmaceuticals is administered by the FDA. Pharma companies need to comply with federal guidelines. However, this is a pandemic and there are companies working to develop a vaccine. We need to stay tuned. Remember, vaccines help to boost the immune system and keep the pathogen from causing serious illness. Besides the symptomatic treatment, this antiviral demonstrated improvements in moderate to severe and severe cases of COVID-19. Remdesivir. Antivirals block virus from attaching to the host cell. By blocking the virus, there is no way for a SARS-CoV-2 to replicate and cause illness. Antivirals also affect the virus from entering the host cell. This decreases the viral count, viral load, and load, taxing and overstimulating the inflammatory response for the serious and fatal nature of COVID-19. There was also initial use of immunomodulators such as chloroquine and its newer version with less side effects. However, the studies on patients seem to cause more harm than benefit. At least we understand that it increased the QT prolongation and negatively affected cardiac patients. There is also a consideration to use plasma patients that were infected by COVID 19. This is called convalescent plasma. This liquid portion of blood have had removed all red blood cells and platelets, and what's left over is the water portion. What's also left is antibodies. Remember that the immune response system, antibodies tag, trap, and destroy pathogen. So in essence, we are giving antibodies to infected individuals. We give antibodies to pregnant patients called ROGAM and IgG to RSV patients, to just name a few. However, we're learning new things about the SARS-CoV-2 virus and COVID-19 every day. So stay informed. We hope you enjoyed this presentation. We thank you for doing your part. You make a difference. We can do this together.